Call City of Franklin Board of Health meeting to order, February 13th, 2023. At this point, Amy is not here and everybody else is present. No citizens for comments. Do we have any unfinished business, or is everything going to be in this meeting? Unfinished business, or is everything going to be in this meeting?
It will be.
Okay. Even, what was the one I was looking at? You were presenting the report to the, that'll be, okay.
Yep.
Okay. Okay, so we'll go right to new business and the administrative report and health improvement plan.
Great. That is what I'm touching on.
Okay.
Board of Health meeting, I brought forward the report to the community that was coming out of our community health assessment. And since then, the Common Council had accepted the report, and it is in its official version now. So to give an update on where we are with that whole project, recap back to last year when we did the first community partner meeting in June, and had about 30 individuals, key stakeholders, leaders come together to pick the main health priorities for Franklin for the next few years, spearheaded by the health department. And then we met again recently last month, stated that were recommended or expressed interest. And we had about the same number, so it was at the Ware Nature Center, and it was a great turnout. Those individuals were represented the data, and then were able to review this report to the community, review additional data that was compiled, and then have conversations about where to go from here. So the main thing our facilitator did, who was again Annie Short, who's facilitated for us in the past, led the group through more or less of how to write a problem statement, and that's what the end goal will be, is to write these problem statements, and then initiatives will form from there. So these groups that will come forward that want to do the boots on the ground type of work. So the next meeting is hopefully within the next month or two. We'll be sending out a save the date for that, and then moving forward with those groups that would like to do the work. So to remind you guys, it is mental health and then physical activity / nutrition. Those were grouped into one by the group that was there. But it really seems as though physical activity is rising to the top based on the data that they're bringing forward. To come to those, if anyone would like to, I'll continue to send out the invite.
Okay.
We'll just aim for 1 to 2 individuals so we don't have a quorum. But just about all sectors from the community are represented.
Great.
And so you can review the final version on your own if you'd like.
Were
And
there
this
many
is for
channels?
No, there weren't. This is the one that was almost 100% when I brought it to you, and then Ellen's community health assessment presentation from last Board of Health meeting, that was the one that had more tweaks.
Okay.
So you also have that, but it was more of just wordsmithing.
Okay.
But that is also for you.
Okay. So anything else under health improvement plan updates? Then we'll go into scheduling system for public health services.
Yes, this is very exciting. So currently, right now, to schedule for all of our programs, it is via telephone. So if someone is looking to schedule a car seat check, flu shot, for one of our senior programs, they call in and our administrative assistant schedules it. So we've been exploring different opportunities that can also give people the capacity to register online. So through different calls that we've made and learning about all these different programs, Greenfield currently has one tap, and we're looking to implement that here within our department. So we would still have over the phone registration for those who prefer it, but then we'll also have an online or internet version of registering for programs. I brought this forward to the director of IT, who has run it through his channel for approval because it won't integrate with any of our other systems. So it won't be pulling data from the cloud and talking to our systems with patient information, but it will need to go to the council for approval. So I would like to ask your guys' official okay to take it forward to council for approval. So
we'll need a motion then.
Move to bring before council.
Okay. Can you reword what the motion's going to be?
Yeah,
Is there a fiscal impact with that?
there is. It will be dependent on what package that we choose, but It will be dependent on what package that we choose, but it'll be a couple $100s a month, and it'll be covered by a grant. So motion to
Bring it forward to the council.
the time tap. Well, let's say motion to bring forward the scheduling system for approval, to council.
Okay, and do we have a second?
I'll second it.
Okay, any discussion? Hearing none, all in favor?
Aye.
Aye.
Opposed? Okay,
Okay, so I have Alderman Barber first, or motion, and then Pat second.
yes.
Great, thank you.
Back to us, right?
I will.
Okay, then we'll go to the opioid settlement funds.
I believe that we may have briefly touched on this before, that the city of Franklin entered into the opioid settlements that were coming forth through the state of Wisconsin. So the city as a whole chose to move forward, to sign on to those, not health department specific. But with the mayor and fire and police, the health
Okay.
department has been around the planning table to determine what the best use for those for our city will be. The settlement has perimeters that you need to work under and has pretty specific outcome choices for what your initiatives are. But I just wanted to give you guys the update that health is around that table. It's really in the early stages. We did receive the first sums of money in August and December of 2021, but we really want to be able to pull information from the health assessment, primary data from fire and police and health in other regards, and get a full picture of what we can really do to make an impact
Sure.
on the opioid front. So anticipate that a plan will be made by the end of 2022,
Oh,
2020.
Okay, any questions at all for administrative? If not, we'll go right to health department general updates and communicable disease referrals.
Well, this will be my first month now to bring this to you guys so that we can get some trend data going in terms of what basis. We track this internally, but not in a forward-facing way. So to protect the small numbers of some, we've decided, along with our public health nurses, to lump more or less into categories. So I'll be reporting out on hepatitis B and C as a category, STIs as a category, and then an other category, which includes the other communicable diseases that we follow up on within the health department. So those would be hospitalized influenza, bacterial meningitis, varicella, and tuberculosis. COVID, we're keeping as a separate category. So since our last meeting in January, we've seen about 20 cases of the communicable disease that I just spoke of. And apologies, you would have a printout of this, but as you know,
It's not
we're having
working.
some connectivity issues. But essentially, it's just a pie chart. So visualize in your mind about 20 cases broken down with 35% of those being hepatitis B and C, 40% being STIs, and then 20% being those other cases.
How many are part of the correction?
A House of Corrections, probably 1 to none.
Oh, really?
Usually, or their internal team is managing that.
Okay.
But it's not necessarily common that we're
But
getting
they don't
those
count
here.
it if, I always thought that if, let's say, their counts would be on Franklin's.
It is, yeah, but that number is pretty slim for this last month.
Is it? Wow,
So
okay.
1 to 0 since
Okay.
last
Wow,
month.
Is it?
So
Wow,
1
okay.
to 0 since
Okay.
last
wow.
meeting that
You're
we
right,
had.
in the past though.
STDs and all that
We've
would-
seen some spikes.
Yeah,
And that can happen too. Sometimes if a big event came through, time of year, but in regards to January,
okay.
but I can bring that as a point of consideration. Is there a different way that you think would be more helpful to present the data, or does that sound like a
In
good
the past, we
presentation
would
for
get the
now?
readout from the state, I believe, and it would be, I believe it was the county, would, Milwaukee County, and then it would be Franklin, and then there would be the services that weren't communicable diseases would be just for Franklin. It's like that.
Oh,
So
okay.
there'd be usually a list of maybe 30-some communicable diseases and how many occurred in the county and how many occurred in the city of Franklin.
And was that on a monthly basis?
It was monthly. I don't know if that was part of ServNet.
Is that something that you would be interested in returning to if we had the capability?
Then we'd at least have an idea how Franklin compares to the county.
We'll have to explore that too a little bit more, because if we have one case of meningitis, since this is such a forward-facing format with our records, we'll have to look at that a little closer, but we can
Right.
figure
Usually,
out how to do that.
big things like when pertussis spiked, you could see the difference. Like last year is like 23, and this year there's 240, or so
Okay.
you could see the what's trending.
Okay, let's continue to explore that then, and
Okay.
I'll look to see what I'll look to see what else we can bring back for March of 2023 to get some trends in front of us, and then
Okay.
maybe a little bit more information.
Sure.
Okay.
I think if you look at any of the when Bill Walker was here, because Courtney didn't do that as much, but Bill did.
All right. See in that regard. All right.
Okay, we'll go to human service referrals.
We have been working with the same health human hazard referrals since December of 2020 of circumstance. So one individual had since passed away.
Was
and
that the
her-
hoarding?
Yes,
Okay.
and her son is still working on the home with
Okay.
the intentions to sell.
Okay.
And then the other one was the hoarded mobile unit, same situation, still under rehab and looking to sell.
Okay, okay. Okay. And no dog bites in, huh?
We do, and I'll lump that under communicable disease, but we're working one active dog bite case, which was like a pretty straightforward case. The individual, it occurred at a home, and both parties involved were in the home.
Oh, okay.
And the dog was up to date on its rabies vaccines and has completed quarantine and compliance. So that one is closed.
Okay. Then we'll move into community health programming, and first would be youth mental health first aid certification.
Yes, this is exciting news in that two of our public health staff, so one public health nurse and our public health specialist, went through the youth mental health first aid training to become facilitators of that program.
Who was it? Who were they?
So Ellen Henry is the
Okay.
public health specialist who received that, and then Kim Krinkle,
Oh.
who did. So with that, they are looking to complete about 3 to 4 trainings this first year of having it. The thought is that there are some district staff that have it, but we want to just bolster the amount of course offerings that we can do, and then hopefully work in tandem with them of populations that we might be missing.
Great. Okay. And audio-visual screenings.
We have been doing our audio visual screenings in the school district for the past month. To remind you, this is when Franklin Health Department goes into the elementary school level for these children. There's an opt-out, but we have a really low opt-out rate, and then the district is able to provide the results to their parents and offer a recommendation for them to go to follow-up if needed. But we're about a little over halfway done with those.
And what age? And what age groups do?
Oh, I actually don't know off the top of my head. Do you
Oh,
know?
I'm trying to remember with the girls, if it was the even numbers, kindergarten, second, fourth, or if it was 1, 3, 5.
So it's every other year almost.
Yeah.
And it's just hearing?
Hearing
vision.
and vision
And
and weight.
vision.
Yeah.
So body mass and
so.
that.
Is there,
BMI. Yeah.
is there any way to know if the parents follow up on your recommendation, or you send them, you
I
send the
feel, I
information?
feel like
home?
I got called because both my daughters needed glasses, and then I think there was a I think there was a follow-up. Like, did you take them in?
We also do a follow-up on that Friday. So if anyone had a test that like weren't sure of or couldn't complete it to fidelity, or weren't in class or forgot their glasses, we give the opportunity we do the AV screen on a Wednesday, and then we see them again on Friday if they had any of those circumstances. But then we work closely with the district nurses who are spearheading the program, and they send that correspondence home to the families
'Cause I know
with
that,
information outlined.
the Lions give you a gift card,
Mm-hmm.
and we donate $100 if they donate $100 if they follow up and need a prescription
Oh,
and need
that's
help.
nice.
I'm glad that you mentioned the Lions because we also have multiple members from the Lions Club acting as volunteers this year again.
Right.
Oh, nice.
So they're helping with the actual AV screen on site, which has been a really nice
I
addition.
was talking to Dirk, and he said that response would be, but it seems to be fairly flat over the time for the same number, maybe 4 or 5 per testing or something that would take advantage of that.
Do you mean that would be getting a referral?
Yeah, and you getting the $100 or
Getting the
whatever.
coupon for the glasses.
So I just didn't know what the out.
Yeah, I'll have to follow up. Jamie Capera, one of our public health nurses, is in the lead of that program this year, and I'll ask her what she intends to do to connect those people or remind the ones that may have a failed vision screen of that glasses
We
option.
can't force them to follow up, but
Yeah, but that's a nice
Incentive,
perk.
follow up, but
Yeah, but that's a nice
incentive,
perk.
yeah.
Yeah.
Okay, Stand Up, Move More program.
Yes, that is one of the programs that one of our public health nurses is currently offering to older adults in the city of Franklin. So individuals could register for that, and the program is in its title to be standing up to increase movement in their day. So it's not necessarily adding this robust physical activity workout or regimen, but really just to be incorporating movement through getting up and moving around.
Where do they do that?
Carol is doing it at one of the senior living facilities.
Okay.
And then I
You
don't know
have to
what
be at
she-
the facility to be,
You did not for this
Okay.
one, but all of her programs are notoriously quick in filling up.
Yeah.
So if we could only replicate her many, many more times, but we'll look to increase to more offerings.
okay, and finally, Franklin Health Department to present at Franklin Senior Dining Program.
As a reminder, the Franklin Senior Dining Program started up again last year. So
That's at the bowling?
yeah, Root River, yeah. So if you guys remember that, it went on a bit of a hiatus, and then we were able to come together with some of the senior leaders, and it had restarted. So now they have speakers come in every month to come to their senior dining site, and the chair of the organization asked the Franklin Health Department to come to some of our programs, reminding individuals that they can get blood pressure screens, just giving general health-related updates, and be there for conversation.
What day are you gonna be there?
It's always the first Wednesday of every month.
it's
So I
more
think
of a
especially-
social function as opposed to the meal program that's here
Mm-hmm.
through the county. Opposed to the meal program that's here through the county.
Mm-hmm. Right.
So this is more of a volunteer social, it's a combination of the walking group that we
Didn't you
have.
get like a grant or funding from one of, somebody that was part of it to keep it going?
What happened was, there was a new leadership coming on to sign up for it, so it kind of went into that, like you said, a hiatus kind of thing. And they had collected funds for eventually building a senior center
Okay,
over time, and realized that they were never gonna get to that. So they gave the money away to like the K-9 unit and the health department for some things. And the city retained, or they gave so much to the city in case this group wanted to come back. And I think that was like seed money
okay.
that was given. And I think that's been made back available to them. So
Okay.
it's kind of like their money, but the city wanted to hold it, or they wanted the city to hold it, the leadership, and then the leadership passed away.
Okay.
So that's kind of where it was left.
How many show up at this?
Probably a good 50.
Wow.
Actually, I heard that last time, so the very first time ever was about 80, or first time after restarting was about 80.
Wow.
And John said it was about 90 to 100
Yeah.
this
Wow.
last time.
It's
great.
well attended, it's the bowling alley.
Mhm.
And they'd have that whole front room,
Right.
And I think there's like at least 10 or more, you know,
Okay.
that
Wow.
are, and I ducked my head in just to follow up on it a month ago or so, because I had some materials I wanted to give them from the previous leadership was still the families,
Mhm.
and they gave me the materials to give to them. So I went there, and it was full.
Wow.
That's great.
They, what?
What type of programs or
They have
speakers?
music. They have music, and then they invite speakers in, and then they to have conversation. And I think some of them even stick around, play some cards or something down the road.
Last month, I think Franklin Fire Department spoke,
Okay,
but they've had the police come. We've talked about department spoke,
okay.
but they've had the police come. We've talked about potentially having
I
someone
think
from the
they
school
talked. The police,
district.
the fire department talked about CPR
Okay.
and stuff and doing that,
That's great.
the training. So
Mhm.
they'll interested in whatever's available.
Sure.
So
Great,
so.
great. Okay, and finally, under Health Department general updates, emergency preparedness.
Just bringing it to the top of mind that we have the 2024 RNC coming to Milwaukee. So the National
All right.
Convention will be held in Milwaukee next year. If you think back in your mind, right before COVID, we were in the midst of planning for the DNC
Right.
to come to Milwaukee. So lucky in a way that we've had some pre-planning, but it's on how to have a safe and healthy RNC. So the health department participated in an RNC planning workshop last week, and there's many, many more and much conversation to come in that regard. But I just wanted to put it in on the top of your minds because it most likely will be coming up quite a bit in our meetings.
And then we'll move to environmental health updates, and we did get approval from the Common Council. So that's for point 3.
We did. So Jamie Kinzel, our sanitarian, went from point 1 to point 4. So a point, and she's already hit the ground running and been very busy.
That's awesome.
Also the DATCAP program, so the program that we're an agent of for the state to do licensing of food establishments here in Franklin, we are required to standardize Jamie. So essentially our standard in the department, Angie, who's our sanitarian who works full-time, trains alongside of her, and then Jamie does more or less a demonstration of her knowledge through a licensed establishment, inspired as a standard from DATCAP to have that completed this year. So we're even more thankful that we were able to increase FTEs to allow for that additional knowledge gain or demonstration of knowledge. And so Jamie is working towards that. But Jamie has also been in the field a very long time and has a lot of friends. So she's a really strong asset to our team. But Angie and her have been working to get to that pre-COVID number of inspections that we typically have, and all the other work that's coming forward with increased establishments here locally.
Okay. And one thing on the side, Milwaukee is a new health director.
They do, well, they have an interim right now, but the former Milwaukee Health Commissioner, Kirsten Johnson, is now the secretary for Governor Evers. So there's a lot of change going on.
And does Greenfield have a health director? Now?
They also have an interim, so one of their public health, I think her technical title was strategist, but I think she acted as a public health manager, but I could be wrong on that. But she's interim right now
Okay.
for them.
So both are still looking or interviewing.
They are.
Okay.
Greenfield's position is open, I think, tomorrow, and I'm not sure the City of Milwaukee hiring plan.
Okay.
But they have an internal interim stepping into that role.
Okay. Okay. Any other questions?
Just, will the RNC increase your workload? Do you anticipate that being?
Big item, which is going to be quite a heavy lift. It already is for emergency preparedness. So in terms of the health department, some of the things that we work on is keeping up to date our local volunteer registry. So we utilize the Weaver system, which is when individuals can pre-register as a volunteer online and have a background check completed, so they're ready to be deployed in the case of any type of volunteer emergency that would need volunteers. So if a tornado were to go through, or if we're needing to do medical countermeasure dispense or some kind of crisis, we can know what level of training people already have, what licenses, etc. So we manage that. We also sit on regional public health emergency preparedness groups. So we have a regional plan that we could launch into action if needed. But it'll be a lot of fine tuning of these plans, a lot of figuring out what we'll need to do to fit into the puzzle, a lot of community communications as we get closer so the community knows what to expect just with every piece of their life that's going to be affected. That I was at, it said, now this is a week and a half ago, so I can't really remember exactly, but it was something along the lines of 500 individuals who were partaking in the conference, 1,500 viewers, and now this seems crazy when I'm saying it out loud, but I think 15,000 media. But now those numbers seem a little, I'll have to follow up on you, but it was something.
I
Yeah, I don't
remember
think
for
that's
the, for the DNC, it was ridiculous. It
Yeah.
was a ton. So I don't think
I
that
could
you're
see
that
that,
far
yeah.
off. It was ridiculous. It
Yeah.
was a ton. So I don't think
I
that
could
you're
see
that
that,
far
yeah.
off.
They said to expect 100,000 people to swoop in for 4 days and then swoop out.
Yeah.
And for public health, that can mean a lot of once the people leave, there's still going to be risk of disease. So
Yeah.
communicable disease follow. The people leave, there's still going to be risk of disease. So
Yeah.
communicable disease follow-up, transmission, things like that. So there's a lot to be
Leaving town?
well prepared.
Leaving town.
Plus every hotel and motel.
Will
Yeah,
not
I'm
be going to
assuming
eat
every
anywhere.
room, I'm assuming every room in Franklin will be booked.
Oh, absolutely.
Oh,
I'm
absolutely.
sure.
For 30 miles because of
And
the.
what time of year is this?
This is mid-July of 2024.
Oh, is it July? Okay.
Of 24.
Okay.
So
Planning your
We'll
trip.
have 2 hotels or 3 or
Yeah.
4, I don't know how
Oh,
many.
well, you got one,
Well-
2,
And
All the
then
motels on 27th Street and,
I think there'll be a third hotel.
Yeah, that's a
Franklin.
hotel they're building, right?
yeah.
yeah,
Yeah,
By the rock.
yeah.
Well, there's a few hotels by the airport and, yeah.
sure.
And downtown, of course, yeah.
that raises a good
Wauwatosa.
point of if events are held for the
Outside.
RNC in suburban communities or outside of the city of Milwaukee hard zone. There'll be a lot of different focus that we need to
Yeah.
bring forward. So.
And one other thing, Lauren's predecessor is now jumping into politics.
Oh, yeah, Courtney, yeah.
Courtney is now running for the alderman in
I
the
heard
4th
that, yeah.
district, so Sherry Hanneman is not going to run this time. So Courtney's put her hat in the ring.
Is she
Okay.
unopposed?
No, she's got Paul,
Ratzenberg.
yeah, Ratzenberg. He is the former finance director, and he's also thrown his hat in. But that, I just want to put you on notice that Lauren cannot leave here and go into politics. This is not
I'm
a stepping
staying
stone.
put for now.
Takes a special breed, doesn't it?
This is not a stepping stone for
Right.
I'll
future
note that.
politicians.
Good to know.
Well, if there's nothing else, we need a motion to adjourn.
Wow.
So move. Or
So all in favor?
aye.
I